want to welcome everybody to the monthly Field Crisis and Consultation Committee meeting. As you know, most of you know, I'm Terry Wilcox-Rickers, a Clinical Services Manager with Behavioral Health and Recovery Services. And I just wanted to go over a little bit of the ground rules just as a reminder. Everything we share in here is confidential. The sheets that we have need to stay in the room afterwards. Some of us can share more openly than others, depending on what agency we're with, about a person. If we have a signed release, then it's more comfortable for all of us to talk about the person very openly. And in some of these cases, we're actually able to get some signed releases. So with that in mind, we have the sign-in sheet going around. And my co-facilitator, would you want to introduce yourself?
Lieutenant Pat Halloran, Belmont PD.
Armando Sandoval, Mobile Support Team, Mateo Long.
Sharon Roth, NAMI and Mental Health Board.
Detective Troy Adams, Belmont PD.
Sergeant Mike Sapanich, Belmont Police Department.
I'm Steve Wagstaff. I'm the District Attorney.
Dave Lashley with Belmont Police Department.
Brad White, General Manager for American Medical Response.
Greg Eatman, the Lieutenant with the Sheriff's Office, currently assigned to Medical Services.
Catherine Barber, Behavioral Health and Recovery Services, Alcohol and Other Drug Services.
Max Rising, Pacifica Police Department.
Robert Anderson, San Mateo Police.
Michael Leon with the Probation Department, Pathways Mental Health Court.
George Peterson with MHA.
Matt Boyle, BHRS.
Pernille Gitschik with BHRS and SMART.
Christina Webb with Conservatorship Investigations.
Dan Hazelton, Daly City Police.
Terry Chu, Daly City Police Department.
Jan Ogar, San Mateo County Emergency Medical Services and staff to SMART.
Lynn Northrup, 18 Adult Services with Adult Protective Services and Probate Investigation.
Marcy Moon with Ongoing Conservatorship.
Thank you all for being here. We have a couple of cases. We have lots of cases, obviously, to go over today. You know, and working with some of the most difficult people in the community and trying to work together to figure out what would be helpful for them. I say that because we actually have a story or a case to share with you to start off with about a really good outcome for somebody who the community struggled with for months, who was constantly in and out of PES, and we really didn't know what to do with him. We were really worried that if he would even make it. So, Pernille, could you give us an update on George?
He was somebody that Daly City Police Department struggled with for quite a long time. He wasn't a super big behavioral problem in the community, but they were really worried because he was kind of known as the park bench guy. He was kind of hanging out, and he would have answers that would usually not make him gravely disabled, but yet not quite well enough to take care of himself. So Officer Chu responded and had responded, I think, several times before, and this time SMART was able to accompany him and take him voluntarily to the clinic where he, in short, got connected with services. We were able to get him back on medication again, which really improved his life a lot. And we were able to get him into a shelter for the time being, and then we're able to work with him on getting him benefits and getting him into permanent housing.
You know, it's remarkable considering where George was just a few months ago, and what a pain, you know, how difficult it was not being able to come up with something that would work for him. Do you want to talk about the case from this morning?
Sure. I've got a new client. Hopefully we can get the same good outcome. I've got a booking photo over. This is Gloria Lopez, and I'll pass Gloria's picture around. Gloria was arrested this morning for petty theft, shoplifting at one of our local liquor stores here in town. She was cited out, but luckily before she was cited out on the petty theft, the officer arrested her, is CIT trained, and was able to get Gloria to divulge that she's bipolar and inconsistent in taking her medication, is a nice way to put it. We've had a lot of contacts with Gloria, mostly for drunken public. Prior to this, she has not been taken to county jail. She's been going to First Chance. She has gone to general on several occasions by AMR because of intoxication. Up to this point, we thought that Gloria was pretty much just a chronic drunk. But Bill McGuigan, who arrested her this morning, was able to talk to her and be able to find out she has a mental health background and that she has a couple of issues going on, and that's why I brought her here today. Bill was able to get her to sign the authorization for her to talk to us, the verbal release form. So we're free to talk openly in both ways about Gloria. Like I said, she was cited out for petty theft, and hopefully we can get her into Pathways. That was our goal. But I'd like to bring her to the group and see if anybody has any suggestions for things we can do to help Gloria.
Other ideas?
Pat? There's Voices of Recovery, which is an excellent support program for people with drug and alcohol problems. Or there's peer-to-peer when she's ready for learning how to control her own illness.
Thank you. Michael, how about the Pathways piece?
Sure. Well, depending on the charge and when she's arraigned, we can get the process rolling in terms of a referral through her attorney. Once she gets arraigned, I can figure out who that is and then ask if she is interested, because it is a voluntary program.
You can make contact with the family, do some family outreach, and assist, in her next contact with the PD here in Belmont.
Yeah, we have her address, and I think she's going to be receptive to the Pathways and to your help, because she was saying how that she was taking the alcohol because she needed it to calm herself down, and that she's not on her medication, and she mentioned that her children have been taken away from her, and that she really wants to reconnect with her children. So I think she's reached a point where she's going to be receptive to help.
Okay, we'll take down the details after the meeting. Thank you.
Yes.
You had said that she had an alcohol problem, and I heard that she had been in First Chance. Has she ever gone through detox at Palm Avenue? Do we know, or should we be looking up that? And does she need detox now?
Yeah. She was not intoxicated this morning when we arrested her. We got to her before she could drink the vodka. I know we typically take our inebriates to First Chance. You'd have to check with Palm Avenue, but like I said, she seems to be at that point. She's reached that point where she's receptive, because prior to now, we didn't know she had a mental health issue. We just thought she was a chronic inebriate.
Yeah, I think she's impacting the EMS system also, so you're seeing fire response, ambulance, and law enforcement.
Wow. Well, it seems like we've got a good plan here, at least on the surface. We'll give it a try, see what happens. We'll regroup here in a month, and as usual, we'll always be talking in between the meetings to see what's going on. And who knows, maybe she'll even need the full-service partnership, to kind of wrap services around her to help her get over the hump and get her life back on the road.